If you've been experiencing symptoms such as joint pain, fatigue, stiffness, or swelling, but your blood tests keep coming back normal, you're definitely not alone. This is one of the most common and frustrating situations patients experience in rheumatology. Many people begin to question themselves. Some wonder whether the symptoms are all in their head, while others feel dismissed because their blood tests don't show anything obvious. But the reality is that blood tests are only one part of the picture, and importantly, it is entirely possible to have genuine symptoms and even inflammatory disease despite normal blood tests. In this video, I'm going to explain why blood tests can sometimes be normal despite ongoing symptoms, what doctors actually look for when assessing inflammatory disease, and when symptoms should still be taken seriously. I'm Dr Naveen Bhadauria, consultant rheumatologist at Pure Rheumatology, London. Let's start with an important point. Blood tests are tools. They help us gather information, but they do not tell the whole story on their own. In rheumatology, diagnosis is based on a combination of symptoms, medical history, examination findings, blood tests, and imaging. No single blood test can perfectly diagnose every condition. Many patients are familiar with inflammatory markers such as CRP and ESR. These blood tests can help detect inflammation in the body. However, they are not perfect. Some people with inflammatory arthritis can still have completely normal CRP and ESR levels. This surprises many patients because people often assume that if their inflammation markers are normal, then nothing inflammatory can be happening. But this is not always true. Let's take rheumatoid arthritis as an example. Many patients with early rheumatoid arthritis may initially have normal inflammatory markers. Symptoms can begin before blood tests become abnormal. Patients may experience prolonged morning stiffness, swelling, pain in the hands or feet, and fatigue despite blood tests appearing normal initially. This is one reason early inflammatory arthritis can sometimes be difficult to diagnose. Another important concept is something called seronegative disease. Many people have heard of rheumatoid factor or anti-CCP antibodies, which are blood tests commonly associated with rheumatoid arthritis. However, not everybody with rheumatoid arthritis has positive antibodies. Some patients are described as seronegative, meaning these tests remain negative despite clear inflammatory arthritis. This is extremely important because diagnosis should never rely purely on one blood test result. Psoriatic arthritis is another good example. Many patients with psoriatic arthritis can have normal inflammatory markers, yet they may still have swollen joints, tendon inflammation, morning stiffness, and fatigue. Similarly, conditions such as ankylosing spondylitis or inflammatory spinal arthritis may also sometimes present with normal blood tests. This is why listening carefully to symptoms is so important. Another important factor is timing. Inflammatory conditions can fluctuate. Symptoms may come and go, and blood tests taken during a quieter phase of disease activity may appear relatively normal. This does not mean symptoms are imaginary. Now let's talk about what doctors actually look for. In rheumatology, we assess patterns. We ask questions such as, is stiffness worse in the morning? Does movement improve symptoms? Are multiple joints affected? Is there swelling? Are symptoms symmetrical? Is fatigue present? Are there autoimmune features such as psoriasis or Raynaud's phenomenon? These details matter enormously. Physical examination is also extremely important. Sometimes subtle joint swelling or tendon inflammation may be detected during examination, even when blood tests are normal. This is where specialist assessment becomes valuable. Another important tool is imaging. Ultrasound and MRI scans can sometimes detect inflammation that blood tests miss. For example, ultrasound may identify synovitis, tendon inflammation, or fluid around joints, even when standard blood tests are normal. MRI scans can also detect early inflammatory changes. This is why diagnosis is not simply based on a blood form alone. Another thing patients often ask is whether a normal blood test means they definitely do not have autoimmune disease. The answer is no. Normal blood tests reduce the likelihood of certain conditions in some situations, but they do not completely exclude inflammatory or autoimmune disease, particularly early on. Fatigue is another extremely important symptom. Fatigue is one of the most common symptoms in autoimmune disease, but fatigue itself does not always show up clearly on blood tests. Patients may feel profoundly exhausted despite relatively normal results. This can be emotionally difficult because fatigue is invisible. Pain is another important issue. Pain is real regardless of whether a blood test detects inflammation. Blood tests are not designed to measure how much pain someone experiences, and this is another reason symptoms should always be listened to properly. Some autoimmune diseases are also simply more difficult to detect early. Conditions such as lupus, Sjogren's syndrome, and inflammatory spinal arthritis can sometimes evolve gradually over time. Blood tests may not initially provide clear answers, and symptoms may change and develop over months or years. This is why follow-up and ongoing assessment can sometimes be important. One thing I always encourage patients to do is look at patterns over time rather than focusing on one isolated test result. Questions such as whether symptoms are progressing, whether stiffness is worsening, whether swelling is developing, whether fatigue is increasing, and whether symptoms are affecting quality of life can all be extremely important. Another common question patients ask is what they should do if blood tests are normal, but they still feel unwell. The first thing is not to ignore persistent symptoms, particularly if you are experiencing prolonged morning stiffness, joint swelling, fatigue, recurrent tendon pain, inflammatory back pain, psoriasis, Raynaud's phenomenon, or other autoimmune features. These symptoms may still warrant further assessment. Another important message is that diagnosis sometimes takes time. In medicine, patterns become clearer over time. Some patients are diagnosed quickly, while others may require monitoring and reassessment before a diagnosis becomes fully apparent. That can understandably be frustrating, but it is quite common in rheumatology. I also think it's important to discuss emotional impact. Many patients feel invalidated when tests are normal. They may feel others think there is nothing wrong, but symptoms should not simply be dismissed because one blood test is normal. Good medicine involves listening carefully to the patient experience alongside investigations. Let's summarize the key messages. Blood tests are useful tools, but they are only one part of diagnosis. Inflammatory markers such as CRP and ESR can sometimes remain normal despite inflammatory disease. Some patients have seronegative autoimmune conditions where standard antibody tests remain negative. Imaging and clinical assessment are often extremely important. Symptoms such as prolonged stiffness, swelling, fatigue, inflammatory back pain, tendon pain, and autoimmune features should still be taken seriously even if blood tests appear normal. Most importantly, normal blood tests do not automatically mean symptoms are not real. If you found this video helpful, make sure to subscribe for more content on joint health and autoimmune disease. And if you're concerned about your symptoms or would like a specialist assessment, I see patients at Pure Rheumatology London. Details are in the description below. Thank you for watching.